Hi, I'm Dr. Susie, and welcome to the First Step Pump. This is where you're going to learn how to contract your pelvic floor and perform a Kegels exercise properly. Now, Kegels exercises are evidence-based for improving men's sexual dysfunction, ED, as well as urinary symptoms. However, many men do this wrong, and if you have never performed a Kegels before, then this is a great place to start. You can perform these exercises incorrectly, which is reason why you should learn how to do it correctly. Because if it's done incorrectly, it can make ED and PE worse. So in today's session, we're going to cover why everyone should start with the pelvic floor and do pelvic floor exercises, how to do the Kegels exercise correctly, and then we're going to practice a 15-minute routine together. For those who have just started on this program, pump is really just the first step. You'll find that there are a number of steps in this program. We start first with learning the Kegels exercise, but then we move on to the second step, which is how to do the reverse Kegels exercise, followed by the third step, how to do pelvic breathing or pelvic RMBT. Then we move on to the fourth step, which is our grounding strategies session, what to do in the heat of the moment, how to keep calm and cool, calm and collected. And in the fifth step, we'll focus on a particular strategy called autogenics training, which is an evidence-based technique of keeping you relaxed, as well as an introduction to exposure therapies. Once you've completed all these sessions, then we'll be ready for our one-to-one and to take our training further with our one-to-one sessions. But first, let's get started with what I call a check-in. I start all my treatment rooms with a check-in. What's a check-in, you say? Well, it's exactly that. It's checking into how you're feeling. Most of us are extremely busy, and from the moment you wake to go to sleep, we're living in our awareness of the external world. We call that being in extraception. But this is an opportunity for us to go inward, what we call introception. That is, what is happening in your internal world? How are you feeling on the inside? Perhaps you've got some muscular tension in your neck. You might want to just let it go. Maybe your bladder feels full, or your stomach's in knots, or your heart feels like it's racing, or you're breathing too fast, or maybe you're periodically sighing or have a blocked nose and you're breathing with your mouth open. How is it that you're feeling at the moment? When you're checking in, one of the most important things that I want you to check into in particular is how you're actually breathing. Check into your breathing right now. In this program, you'll find that there is a huge emphasis on ensuring that our men are breathing from the belly. When you breathe from the belly, you're going to strengthen the system called the parasympathetic nervous system. Remember your autonomic nervous system, there's two branches, the sympathetic nervous system or the fight-flight system, and the parasympathetic nervous system, which is the rest-digest system. I want you to check into your breathing right now. Place one hand on the thoracic cage and one hand on your belly. And just find out, feel, where are you breathing the most from? Are you breathing more from the upper part of the chest? Or do you feel that when you're breathing in that your belly is softly rising and that you're not breathing much from the chest? That's the correct way to breathe, by the way. You should be breathing from the belly. And if you are breathing from the upper part of the chest, you're quite often breathing, you're a dysfunctional breather. You may be a person that has anxiety a lot of the times, or perhaps you breathe with your mouth open at night, or snore, or have a history of asthma or bronchitis, and you may be stuck in this breathing pattern. If you are, I want you just to gently revert now to being a belly breather. Concentrate on when you're breathing in, that the belly expands, and that when you breathe out, the belly goes in. The reason that we want to breathe this way is that when you're breathing from the belly, you're engaging your diaphragm. And your diaphragm, as you're breathing in, should drop down, open up and expand. And as it's doing so, it engages with the vagus nerve. And when the vagus nerve gets activated, that's the largest nerve of the parasympathetic nervous system, you're more likely to be relaxed. When you're breathing from the upper part of the chest, you tend to not get in as much oxygen, you have a faster breathing rate, and you will also activate the sympathetic nervous system, which is the fight or flight system. This particular system is not great for sex. It tends to cause erectile dysfunction as well as premature ejaculation. So we want to be strengthening our parasympathetic nervous system and always keeping our breathing from the belly. So you want to practice breathing from the belly and strengthening this system as much as you can. In terms of doing pelvic floor exercises, how much do you need this? Who should be doing this? Well, I would invite all men with any of these symptoms to do pelvic floor. That is, if you've got erectile dysfunction, premature ejaculation, delayed ejaculation, reduced nocturnal or morning erections, find that you've got urinary symptoms like urinary frequency, urgency, nighttime waking, or perhaps some lower urinary tract symptoms suggestive of the prostate, that such as difficulty starting, stopping, hesitancy, poor stream, dribbling. If you've got a history of chronic constipation, chronic pelvic pain, or if you've had any surgery to the prostate, then you should be doing these exercises. Kegels exercises are free. I invite all men to do it. It's a simple protocol. We encourage men to do this in the morning and encourage men to do this in the evening. It takes about 15 minutes and most people will see results within 3 months. So I would basically say that pelvic floor exercise, or doing the Kegels exercise in particular, is a prescription for everybody. It's what I call a non-drug essential. And in fact, for many men who have got psychogenic erectile dysfunction or acquired premature ejaculation, they may not even need medications should they learn how to use the pelvic floor, as well as sexology skills and psychology, which are important non-drug treatments. They may not even need drug treatments at all. So it is a very, very important strategy for a lot of patients on our program. The pelvic floor, just so you're aware, everyone's got one, but you don't necessarily know much about it because you can't see it. But it's a set of muscles, and there are about 26 of these muscles, and they're overlapping each other. There's superficial and deep layers, and there's quite a lot of different muscles, but it's an important group of muscles. It sits like a hammock at the base, and it supports your bladder and bowel. It's essentially what stops your internal organs from falling out. But even though you can't see it, and even though it's there, many people aren't aware that it's actually also moving, and moving in particular with our breath. So the pelvic floor is not concrete. It's not just static and stiff and sitting there. In fact, there is movement with your pelvic floor too. You can move it voluntarily, but it's also moving involuntarily with your breath. So the question really is, how toned is your pelvic floor? Is it strong? Is it flexible? Some maybe have a weak pelvic floor, others may also have a stiff pelvic floor. This program is going to help you engage more with your pelvic floor and also learn not only to get it nice and strong, but also how to relax the pelvic floor, importantly too. Many men ask me, well, why is pelvic floor exercises improving my erections? How exactly does that work? There are a number of different mechanisms, but a very important analogy that can assist you with understanding how doing pelvic floor exercises or Kegels exercises or strengthening the pelvic floor can improve penile flow is with the analogy of a blood pressure cuff. I'm sure you've had your blood pressures checked before, and when you have a blood pressure cuff on your arm, there's this cuff around you. Think of that like a cuff of muscles around your penis. When it blows up or it's nice and strong, there's engorgement and it keeps the blood down there. You might feel your arm feeling a bit uncomfortable. It's a bit like an erection. You have a cuff of muscles of your pelvic floor, and if you make those toned and strong, it acts like a natural blood pressure cuff, keeping the blood flow there, keeping the flow there longer and stronger. The benefits of doing pelvic floor exercise are numerous. We know that there is strong evidence it improves sexual function. Within about 3 months, there are a number of studies that show that it improves erections, ejaculation, urinary and bowel control. It also increases your awareness of your pelvis and your genitals. It increases that sensitivity, your ability to control your pelvic floor. By incorporating the belly breathing, or what we will call pelvic breathing techniques, it's going to strengthen that parasympathetic nervous system. That's a very important nervous system for maintaining good sexual function. For those that have been dialed up on the sympathetic nervous system, that is their fight-flight system is overactive or it's upregulated, then incorporating the pelvic breathing and learning how to utilize your pelvic floor during breath is going to be super important. But it's really a very important strategy to help men jump out of their head, jump back into their bodies, and shift that sexual focus back into the internal body experience. Essentially, by learning how to use your pelvic floor, and in particular, learning how to relax the pelvic floor, you can also override that reflex ejaculation for premature ejaculation. But as mentioned before, you can incorrectly train. There are a number of men out there who have done Kegels and have found that their ED or PE has gotten worse. That's true. You can, in fact, overtrain certain muscles so that there is dyssynergy. You've got set muscles here that are really strong and a set over here that are not strong. And so you've got this imbalance in the pelvic floor. You can have it so strong, that certain set of muscles, like your bulbospongiosum over here, so strong that it actually stops the engorgement process. So it is important that when you are doing the training that you learn that there are two different types of exercises. We're going to cover that. There's what we call the fast twitch as well as the slow twitch skeletal muscle exercise for the pelvic floor, but that you also contract all the areas of the pelvic floor, not just one area only. Okay, so let's get to it. I want you now to find your pelvic floor. I want you to find your pelvic floor intuitively. I want you to pretend that you're busting to go to the loo and you're trying to hold on to a pee and a poo at the same time. I want you to do that now and contract. And as you're doing that, you can feel what it feels like to have your pelvic floor in a contraction. Now what I want to do is break down the 3 actions to a pelvic floor contraction to ensure that you are contracting correctly. Okay, so you can do it intuitively, but are you doing these 3 actions? The first action to do a pelvic floor contraction or a Kegels exercise correctly is a feeling of a shortening of the penis, a drawing inwards of the penis. It's a little bit like a turtleneck going into the shell. Okay, you've seen a turtleneck going into the shell. I want you to feel as though you're shortening the penis, as though you feel the base of the penis tightening, and it's a subtle inward movement towards the body. The second action to the contraction is feeling as though you're stopping the flow of the urine. It's like a tightening around the penis. The third action to the contraction is feeling that the anus is tightening. So tightening the anus, drawing it upwards and inwards, but ensuring at the same time that you're not clenching your butt cheeks, okay? You want to keep your butt cheeks nice and relaxed. So I call this the 3 actions to the contraction. Remember, when you're doing a pelvic floor exercise, you want to be shortening the penis, stopping the flow of the urine, and tightening the anus to draw in all those areas of the pelvic floor together, all whilst belly breathing. And we'll be focusing on not only the contraction, but allowing that muscle to fully relax. We don't want to be contracting a muscle and then contract on a contracted muscle. For a toned muscle, you want to contract and then allow that muscle to completely relax before you do the contraction again. When it comes to performing Kegels correctly, I would encourage you to do 2 different types of exercises as part of your routine. And this is so that you can create a toned muscle, not that big bulky muscle that are only focused on perhaps strength, but we want a toned pelvic floor. And a toned pelvic floor is not only one that's strong, but also has endurance. There are 2 types of skeletal muscles. There are what we call fast twitch fibers, and there are those that are slow twitch fibers. And these are different types of skeletal muscle that do different things. Fast twitch fibers are ones for strength. If you're a sprinter, you'd have lots of fast twitch fibers. If you're a marathon runner, you would have conversely a lot more slow twitch fibers. These are the ones for endurance. Fast twitch fibers are going to contract really vigorously at 100%. Slow twitch fibers are going to contract a little less vigorously, but can hold a lot longer, and then they relax. When we're doing these exercises or the Kegels exercise, we're going to do these 2 different exercises, what's called the fast twitch fiber and the slow twitch exercises. We want to do both. In fact, your pelvic floor is made up of 2/3 of slow twitch exercise. So those that concentrate too much on just the fast twitch are the ones that are going to cause dyssynergy or muscle strength, muscle spasm, or imbalance in the way that their musculature is. So let's get started. Let's get into the pelvic floor routine. Our current protocol for men's Kegels exercise is for men to perform both fast and slow twitch. We recommend that you perform 10 fast twitch, followed by 10 slow twitch. That's a set, and that you do this 3 times. Let's do this together right now. Let's get into the fast twitch first. So, to do this exercise, you can do it lying down, but I prefer to get it done. I prefer to do it in a seated position. If you've got a saddle chair, even better, but otherwise a hard surface chair is good to provide a little bit of feedback. You want to ensure that your spine is nice and straight, and you want to make sure that you're breathing from the belly. Now, a lot of men will be very concerned about coordinating their breathing. In this particular session, try not to worry too much about the coordination of your breathing. Try not to hold your breath, but at the same time, just try and breathe from your belly. We'll be able to coordinate your breathing more in subsequent sessions. This session is really about just getting the fast twitch and slow twitch exercise correct and feeling those 3 actions to the contraction. So when you're ready, breathing from your belly, I want you to do 10 fast twitch. I'm going to ask you to contract and then relax. Remember, when you're drawing in those 3 actions to the contraction, you want to contract at 100% and then relax. Ready when you are. Contract, relax, contract, relax, contract, relax, contract, relax, contract, relax. Halfway, contract, relax, contract, relax. That's it. Contract, relax, contract, relax. Last one, contract, relax. Well done. You just did 10 fast twitch exercises. Those are the strength work. Now let's get into the endurance fibers. These are the slow twitch exercises. They're a little bit harder. Most men will complain that they're a little bit more difficult, particularly when they first start. You want to hold this for 10 seconds. So we're going to ask you to hold the contraction this time for 10 seconds before you release it. Now remember, when you contract, you don't have to contract at 100%. You can contract at about 50%, but just hold it there for as long as you can. You can build up from 10 seconds to longer as you get stronger. Remember, no one ran a marathon straight away. You've got to train first. Okay, let's do it. Belly breathing, spine nice and straight. And when you're ready, let's hold it up there and contract for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. That's it. And let it go. Release. Well done. Allow that muscle fiber to drop back down. You can feel the pelvic floor relaxing and dropping back down. That's it. Good. Let's do it again. Contract, holding it up there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release. Let it go. Allow the pelvic floor to soften, to drop back down, and let go again. Good work. You want to make sure that muscle is completely let go and relaxed before we go back into the next contraction. Let's do it now. Contract, holding it there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. That's it. Remember, these are the endurance fibers. Let it go. These are the ones for longer lasting sex. That's it. Allowing that muscle to relax. Keep breathing from your belly. And now let's draw it up again and contract it there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Let it go. Relax, release, let go. Don't forget those 3 actions to the contraction. You're drawing the penis inwards, you're stopping the flow of urine, and you're drawing the anus upwards and inwards, but not clenching your butt cheeks. Okay, let's do it again. Halfway there. Contract, drawing it up for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. Release. Excellent. You'll feel that pelvic floor dropping back down. Let's do it again. Contract. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Let go. That's it. Remember the pelvic floor, 2/3 are slow twitch fibers. So it's very important that we train this particular exercise. It's very much a forgotten one. All right, let's do it again. Contract, holding it there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Let it go. Relax. Now, the relaxation phase is just as important as the contraction phase. In our next step, we'll be learning more about how to relax the pelvic floor doing the reverse Kegels so that you can get more in touch with this relaxation phase. Relaxation is not just the absence of the contraction. It's quite an active process within itself. All right, let's do the contraction again. Let's do it. Contract. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax, release, let go. Well done. Good work. All right, 2 more to go. Let's do it now. Contract, holding it there. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax, release, let go. Feel that muscle gently unwind. Excellent. Get in touch with it. Last one. Let's contract, holding it upward. Remember the 3 actions to the contraction: drawing the penis inwards, stopping the flow of urine, tightening around the anus. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. That's it. Feel the pelvic floor, relax, release, and drop back down. Well done. You just did an entire set of slow twitch. Good work. Let's move on to the second set of fast twitch. Remember the fast and the furious. We're learning to contract really strong now and then relax, let it go. Let's do it. Sitting up nice and tall. Ready when you are. Contract, relax, contract, relax. That's it. Contract, relax, contract, relax, contract, relax. Halfway. Contract, relax, contract, relax, contract, relax, contract, relax. Last one, contract, relax. That's it. Hope you're feeling really pumped up. You should be certainly warm down below, maybe a little bit of tingling. Blood should be flowing. Good work. Let's get into the second set of slow twitch. Remember, these are the really important ones. Might be a little harder, but certainly worthwhile. These are the endurance fibers. Ready when you are. Belly breathing. Let's hold it there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. Let it relax, let it release, let that muscle elongate as it drops back down. Good work. Let's do it again. Contract, drawing it up and in for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Excellent. Let it go. Relax. Good work. Remember, you want to make sure that you engage with the relaxation phase. Give that muscle enough time to relax before you do that contraction again. We want toned muscle. Feel it moving up. Feel it moving down when you relax. Okay, let's contract it up again. Contract, drawing upwards and inwards. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And relax, release, let go. Good work. Breathing from your belly. Excellent. Let's do it again. Contract, holding it up for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. Relax. Good work. Halfway there. Let's do it now. Holding it there. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. It's all very good and well when you're training your biceps and your quadriceps. You can see that muscle every time you go to the gym. You can see it getting better and bigger, but it's hard to know what's happening with your pelvic floor. Some early signs of improvement. A lot of men will share with us that They've got an improvement in nocturnal and morning erections, one of the early signs. All right, let's do that contraction again. Contract, holding it there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. Well done. You can do this exercise first thing in the morning when you wake up in bed, or perhaps you can consider every time you're seated that you might want to do some sets of fast and slow twitch. In the car is always a good exercise time. Whilst you're in the car, you can definitely be doing this. No one will know. All right, let's do it again. Contract, holding it there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. That's it. Let it go. And last one. Let's do it now. Holding it up there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. Good work. You've just done 2 sets. Let's fire on. We're going to go into our 3rd set of fast twitch. Remember, these are the strength fibers. We want to contract these at 100%. Ready when you are, spine up nice and straight, breathing from the belly, and contract, release, contract, release. That's it. Contract, release, contract, release, contract, release, contract, release, contract, release, contract, release, contract, release. Last one, contract, release. Well done. That was 10 fast twitch. Those are your strength exercises, all done. Let's move on to the final set of your slow twitch exercises. Sitting up nice and straight, breathing from your belly and holding it there, holding it up for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let go. Well done. Excellent. Let's do that again. Holding it up for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. It's okay if you're feeling that there are areas dropping off. Sometimes you might find that the area around the penis drops off, or perhaps around the anus, you can feel that muscle drop off. That's okay. Just pick it back up and contract it again. Let's do it now. Ready when you are, contracting for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Let go. It takes a little while to get that strength up and also to be able to sync those muscles together. It's okay if things drop off a little. It gets easier and easier with practice. Let's do it again. Contract, holding it there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. Release. Allow that muscle to relax. Good. We don't want tight muscles. We want toned muscles. Ones that are strong, but ones that are also flexible too. All right, let's do it again. Halfway there. And contract, holding up and in for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. Don't forget your 3 actions to the contraction. Penis in, stopping the flow of urine, tightening the anus. Let's do it again. Contract, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let it go. Relax, release, let go. Pelvic floor is a very interesting space. I call it a very emotional organ. Holds on to a lot of stress, so don't forget to let it go. All right, second last one. Contract, holding it up for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and letting it go. Well done. Feel that pelvic floor drop back down. That's it. Feel it gently relaxing, like a flower opening up, blooming. All right, second last one. And contract, holding it there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and letting it go. Relax, release, let go. You'll find in the rest of the program that we'll use a lot of different visualization exercises to try and get you more in touch with the pelvic floor. It's not a space that you're normally used to. Last one, let's do it. Let's make it worth it. And contract, holding it there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax, release, let go. Well done. You did your pelvic floor exercise for today. You just did 3 sets of fast twitch and the slow twitch. Good work. Now, before we go, I like to leave everybody with a little visualization exercise. It's always good to have a plan, to know where you're going, and a good idea is to visualize what it would feel like to be king of your bedroom. So before you go to bed, I want you to plant this seed. It's a little seed of what it is that is going to be success for you. What does it feel like? Not just what it looks like. What does it feel like to be king of your bedroom? And play out that moments of satisfaction, because that is where you are going to be heading. Well, thank you for joining me for Pump today. I hope that you will be able to start scheduling into your routine to do your Kegels exercise. Remember, you must go into your belly breathing. Check into how you're breathing regularly. Am I breathing from the top part of my lungs? Am I breathing from my belly? Revert to the belly. This is where you want to be. When you do your Kegels exercise, remember there are 2 different types of exercises. We want to concentrate on not just the fast twitch, which are for the strength. We want to make sure that we concentrate on the slow twitch exercise too, which is for endurance, ensuring that you also tune into the relaxation phase of that muscle too. You should do this in the morning and you should do this in the evening. And I hope after the 12 weeks of this program that you will be seeing some results. Not just results in your sexual, in increase in pelvic awareness, but also results in your sexual function. If you find it hard to find the time to integrate this into your routine, then we do in fact have the 15-minute audio, so you can just press play. So you can find that on the learning management system. There is simply the Kegels exercise routine that you can practice, so you can be guided to do the exercises with me. I hope that you've enjoyed Pump, and I hope that you will join me for the next step, which is learning how to relax the pelvic floor, otherwise known as the reverse Kegel. Have a great day.